Hi everyone, this is Mr. Neil Writer, consultant audiologist and director of ClearWax. Thank you for joining me in another demonstration video of our recently developed WAXscope, which is due to be launched in early December 2022, fingers crossed. If you are interested in the WAXscope, please do email info@clearwax.co.uk and we can add you to our mailing list. So we have a patient here who attended with bilateral, occluding dry earwax, and this is the patient's right ear. And as you can see, we're just using a standard zonal suction probe to remove this wax. We also are using our 4.25mm speculum to remove this, to dilate and straighten the ear canal. We have different size speculum, so the smallest one is a 3.5mm. This is probably going to be our most used one, a 4.25, and then we've got a 5mm and a 5.75. So just a bit of residual wax on the anterior lateral canal wall. We're just going to adjust the focus. I'm now using a fine end suction probe. Whilst you're watching this, I just want to go through our candidacy criteria. We've had a lot of interest, which is great, both for the WAXscope and our iClearScope. And in terms of our eligibility criteria, it is on our website. So if you visit www.clearwax.co.uk and then the For Professionals tab, we've got a section there that says training, and we've got our candidacy criteria, and that includes audiologists, audiological scientists, hearing aid dispensers, hearing care assistants, general practitioners, physician associates, ENT specialists, and then nurses, pharmacists, independent prescribers, and advanced paramedics who have relevant ear experience and training. For example, they are already performing routine otoscopic examinations as part of their current role, or are able to prescribe medication for the ear. Importantly, from that list, all of the specialists are all qualified, and they're not going through the training. They are qualified, and they are qualified ear professionals in particular. So we've had a lot of inquiries from people who are currently going through their training and not yet qualified, or people from other professions who some of them are not clinical. Unfortunately, earwax removal is not an easy thing, and maybe it's been too trivialized. But for me, as an audiologist myself, earwax removal for me is probably the most difficult thing I do, with the most potential risks. So for that reason, I think if I was a member of the public, I would want the person who I'm seeing to have at least be a qualified ear professional in some capacity. So I just thought I'll outline that, because we do have a lot of requests on a daily basis from non-clinical professionals and who are not yet qualified. So this is the patient's left ear. You saw we cleared the right ear. They got a narrow bendy ear canal. Now you can see there's a slight retraction there. That's the short process of the malleus. It is slightly retracted. You can see the tympanic membrane, the stretch marks on the posterior superior quadrant. Just having another look in. So you can see quite a bendy ear, but we did tympanometry. They have got eustachian tube dysfunction in this, their left ear, the right ear is fine. Well, I hope you enjoyed that video, and if you are interested in either the iClearScope or the WAXscope, please do email info@clearwax.co.uk. Thank you.